Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Dr. Aaron Amato, Medical Director for Montana Psychiatry in Billings, Montana. Dr. Amato is a child, adolescent, and adult psychiatrist and an expert in personalized medicine. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
Welcome to Redefining Medicine. I am so pleased to welcome Dr. Amato to the podcast today. She has been practicing medicine for 16 years in the field of psychiatry. Welcome today. It's very nice to talk with you.
Thanks for having me.
Of course. So what made you want to become a doctor in general?
Well, I remember being interested in the human body and in medicine even from when I was really little. My family had a set of childcraft books, kind of kids' encyclopedias, and there was one on the human body, and I think I wore that out just reading about different things that had to do with medicine. And my father was also going through medical school and residency when I was young, and I remember going to visit him when he was on call and even rounding with him sometimes. So the interest was there early on, but it wasn't until I was quite a bit older that I decided that was the direction I wanted to pursue.
Okay. So you're speaking about breaking through TMS, ketamine, and integrative psychiatry for mental health disorders. Can you please give us a little summary of what you'll be talking about?
Yes. So I'm excited to tell people about these innovative treatments for particularly depression that's not responding to more traditional approaches like with medications or talk therapy. So TMS stands for transcranial magnetic stimulation. It's a non-invasive type of brain stimulation that can be really helpful for depression. And then ketamine is a medication that's been around for decades, since the early 60s. But it's just been in the last 10 years or so that it's been incorporated into outpatient treatment for depression that's not responding to other treatments. And it's also been shown to help with PTSD as well. So I'm excited to tell people in the audience about these treatments because we just need more tools in our toolbox to help people with mental health disorders.
Oh, wow. Well, what are some key takeaways that are important for our audience here to know from your lecture?
I think the importance of just knowing that these treatments are out there and that people don't have to go years or decades of trying medication after medication, dealing with side effects, if there are these innovative treatments that could be effective earlier on. So that's my hope, is raising that awareness and helping people understand who might be a good candidate for this treatment so they can get the help they need.
So I'd like to ask you, the use of psychedelics to treat anxiety and depression is a new hot topic. Can you expand on that a little further?
Yes, there's a lot of interest about that, and it's interesting how things come around again, because there was a lot of interest in the 60s and even into the 70s and 80s, fell out of favor. Now we see that interest again. But there are over 25 university programs that have studies dedicated to psychedelic medicine or psychiatry. And we're seeing pretty astounding results with things like psilocybin, MDMA, looking at things like treatment-resistant depression, anxiety at the end of life, and even PTSD. And I think it's so wonderful that people have a lot to look forward to in the next several years. For people who felt like maybe they've run the gamut of psychiatric treatments and they've run out of hope, I tell people all the time, please hang on. There are really exciting things happening in our field. So we're seeing this, first of all, with ketamine. Ketamine has kind of opened the door to this discussion about psychedelic medicine and approaches, but we've definitely got more on the horizon.
So when patients are using these psychedelics, they're being monitored in a controlled environment with a clinician, correct?
Absolutely, that's very important. We have to be very mindful about safety parameters around these sorts of treatments. But one thing I talk to people about often is the importance of set and setting. So set being mindset, so the mindset that people come in being curious about this type of exploration of their own mind, feeling optimistic and hopeful, but also the setting piece, and that's where being in a monitored, controlled environment is important, and just having that therapeutic support, because there's a lot that can come up with this psychedelic therapy that it's so important to have a trained professional where you can process and integrate this material so it really does lead to lasting therapeutic results. So these are not things that are ready for prime time. They are still in clinical trials and studies, but I tell people all the time, just keep checking in, keep watching what's happening in the news, because I'm hoping in the next few years that more of these agents will be available for us to use within the medical field.
Okay, thank you so much for sharing that. So as you know, this past year and a half has been a tough time mental health-wise for us all. What tips do you give your patients to keep a positive mind and healthy lifestyle?
Well, I've talked a lot with people about trying to shift from not just looking at the negatives of what's going on in the world, to being very intentional about looking at the positives. And a great way to do that is with gratitude exercises on a daily basis. I also talk to people about the importance of managing their stress effectively, because that has so much of an impact on their physical health and on their immune health. And so that mind-body connection is so important. And then a really big takeaway, I think, is that even before COVID and the pandemic, we were dealing with an epidemic of loneliness in this country, and loneliness has a huge impact on chronic health risks. So I talk to people about making sure they're really trying to stay connected with other people and cultivate deep relationships, because it's so important.
Those are some great tips, thank you. What hobbies and interests do you partake in to live a healthy lifestyle?
One that's become a bigger thing for me in recent years is spending time in nature, which is an easy thing to do in my beautiful home state of Montana. So we have a family cabin that I love going to because it makes it so easy to unplug and get in touch with nature. And then another thing that's not necessarily a hobby, but a tool that's been really helpful for me is using a continuous glucose monitor. I just turned 47 this week, and
Wow.
I'm pre-diabetic, and I have a strong family history of Alzheimer's disease. So using a continuous glucose monitor in the last couple of years has really helped me take my health to another level, and I just find that that sort of data is so empowering.
Wow, well, you definitely don't look 47.
Well, thank you.
If you could be known for one thing, what would that one thing be?
I would like to be known for someone who's not afraid of disruption and innovation in my field. And I'm really hoping to introduce more people to the idea of solutions beyond the prescription pad when it comes to mental health.
Wow, that's a great goal. Thank you so much for sharing all your tips with us and your knowledge. I appreciate it.
Thank you.